everybody. It's Mary Beth Decker with sacredgrove.com, and I'm here with Dr. Jordan Kocen this morning, and we're going to talk about acupuncture for animals. Now, I know about acupuncture. I knew about it for a long time, but I didn't think about it for animals. But now that I'm working sometimes at the Veterinary Holistic Center on Mondays, I know a lot more, but I thought I'd share it with everybody else. So that's why we're doing the video today. And let me just start with Dr. Kocen's bio, because that's always good to know who's giving you the information, like, you know, this guy's the real deal if you don't know him. So Dr. Kocen received his Doctor of Veterinary Medicine degree from the University of Missouri College of Veterinary Medicine and has practiced in Northern Virginia ever since. After practicing general small animal medicine for several years, he was certified in veterinary acupuncture in 1990. At the time, Dr. Kocen was the only veterinarian in Northern Virginia providing that service. Over the next few years, he trained in Chinese herbal medicine and homeopathy. The majority of his appointments were people coming in for holistic medicine. So Dr. Kocen joined Southpaw's veterinary specialists when they first opened in Springfield, Virginia in 1995, and headed the holistic medical medicine department for 19 years. So you're talking to somebody you're listening to somebody who really knows their stuff. To increase the availability of alternative therapies for small animals, Dr. Kocen opened the Veterinary Holistic Center in North Springfield in September 2015. Okay, so I can put that one away and pull another up. So I want to thank you. You gave me a list of questions of what people want to know. What do they ask about? And that's where we're going to start. So how does acupuncture work? Now, so I have pictures, and I've had it done to me, of little tiny needles stuck in very odd places. Beyond that, how does it work?
Well, Mary Beth, thanks for having me, of course.
Sure.
And I think the most important thing is to talk about how acupuncture works, because many people have misperceptions of how it works, and those misperceptions tends to make them shy away from getting acupuncture for themselves or for their pets. And in a way, we need to separate how acupuncture works from Chinese medicine theory. And the theory is thousands of years old, based in early culture, agrarian society, and passed on by word of mouth for a long time before it was written down. So many times the words and the concepts are foreign, particularly to a Western perspective. But those were ways to try to describe why it worked, not that it worked or it didn't work. So on a physical level entirely, when we do acupuncture with animals or with people, we use very thin, sterile stainless steel needles. And by thin, I will tell clients, you could put 7 or 8 of these needles inside of a vaccine needle. That's how tiny these are. From a medical perspective, this is called a 36 gauge needle, really, really thin, not that long. And we are trying to stimulate an acupuncture point. An acupuncture point is an area in the muscle layer under the skin that has a high concentration of nerve endings. So when you put a needle in there, every one of those nerve endings is stimulated, just like getting a splinter in your finger. And every one of them shoots a message up to the spinal cord, and they basically all say the same thing. Someone just stuck a needle in here. And it's up to the spinal cord and the system to decide how to respond to that. The initial message is to shoot messages back down there saying, get that thing out of there. Well, this is going to increase blood flow. It's going to cause the release of anti-inflammatory chemicals. It's going to bring in white blood cells and flush out toxins. So that's kind of the local effect of putting a needle anywhere. This is why dry needling will work too. If you see a physical therapist or someone who's not truly an acupuncturist, they're simply stimulating an area. But once those initial messages make it to the spinal cord, messages now go up and down the spinal cord and pop out at different nerves to affect other parts of the body. Number one, to move away from the stimulus. So if you get a splinter, you're not only going to lift your hand, you're going to lean back. And all of that is from that one little poke on the tip of your finger. But nerves from the spinal cord also go to the liver, go to the heart, go to the kidney, certainly go to the brain. And the Chinese mapped out when a needle is put in a certain spot, certain results will consistently occur. So if you need a certain result, in a way, you look at the map and say, if I put a needle here by the thumb, not only is it good for the thumb, but it's good for a runny nose. Or there's many people are aware there's a point on the inside of your wrist that is very good for nausea. If you go on a cruise, they give you a seasickness bracelet. You're basically just doing acupressure on a particular acupuncture point, which will help to settle your stomach. Why this point is listed or is located by your wrist, we don't know, but it is.
Can you show me the wrist? Because we're all visual right now. Right there. Okay,
So
I got
right here,
a kid I'm taking to
right in the
Africa
middle,
and she's on
right in the
safari.
middle,
Right here?
left or right sided,
Okay.
and you can just use your thumb and do acupressure rather than spending money on an air sickness or a seasickness bracelet. When that starts, or nausea for any reason, it'll help to settle your stomach. It's a good wrist point too, but again, it has distal effects, as I like to say. So on a totally physical level, acupuncture's initial effect is through the nervous system. The nervous system goes to all your organs, so then it's going to stimulate chemical release. Then you'll get some hormonal or other chemicals floating around your bloodstream, so you double up the message. And the body's main messaging system is electrical, which is the nervous system, and secondary is chemical, which is the hormones and chemicals. And it's a redundant system, which is very good, because if one is delayed, the other will work. Think of the initial message getting through, and then the chemical message following to enhance those effects. Usually the needles are in place for about 15 to 20 minutes because not all nerves respond immediately. So by leaving the needle in, it gives a better chance for all of those messages that need to make it to the spinal cord and complete the circuit to do what they're going to do. Usually after 15 or 20 minutes, there's no added benefit. So for our patients, we usually do 15 to 20 minutes. In the literature, there is case reports and documentation that may say for certain conditions, 20 minutes, for certain conditions, 30 minutes. For some conditions, put it in and take it right back out. It depends on the practitioner, it depends on their experience and the nature of what you're treating. My experience is the longer the problem's been there, which is what we see, older dogs, chronic problems, you need 15 to 20 minutes. Young, healthy animals, young, healthy people, often a needle in and out of a few spots and your treatment's done. Because your body is more responsive, neurologically, you're more receptive. As you get older, you get a little slower. So it takes a little longer for the message to get through.
Yeah, that makes sense. So how effective is it? And I mean, sticking needle in certain spots.
Right. Well, certainly, since your nerves go everywhere, hypothetically, acupuncture could treat everything. But certainly, as with most therapies, there's some conditions for which it's really good and some conditions for which it's fair. And I suppose a few conditions, maybe it won't work at all. Mainly stiffness, mobility, aches and pains, things related to the muscles, the ligaments and tendons, the connective tissue seems to be the most responsive. And that's what draws most people to acupuncture for themselves as well as for their pets. Within that, certainly on the mobility front, I would confidently say 80% of the patients or more that we treat show improvements, which is pretty amazing. And it's because we're stimulating the body's own system. Pharmaceuticals are really helpful, whether it's pain medications, whether if it's anti-inflammatories, even muscle relaxers, but they're non-specific. They go everywhere. You can't target where they go. Since we're getting into the body's mechanism, we can decide which muscles to relax, which areas to tighten, how to shift the weight, all through using the body's internal mechanisms. You're in there pulling the levers, so to speak. The only limitation is, can they get better? If you have lost nerve function someplace, I don't think acupuncture can work well because you only have the chemical messenger. But if you have some nerve function, you'll get improvement. If you have a fair amount of nerve function, but maybe there's some nerve compression, the nerves are being pinched and therefore diminished activity, with a few acupuncture treatments, we see continued improvement, not just they get a little bit better depending on the patient, but many continue to improve until they reach a plateau. Most often than not, it takes a few treatments to see if it's helping or not helping. My guidelines have been, if things usually start by the third or fourth treatment. This is not to say they can't show improvement with the first or the second. we often see a temporary improvement, and then it drops off. Next time a little more, drops off less, next time a little more. If we get to 6 treatments and there's no discernible improvement, then I have to say to the clients, I don't think it's going to work. Fortunately, that's really rare that we have to say that, because so many show improvements. The longer the problem's been there, the more physical the problem may be, may limit how much better they can get, but doesn't limit can they get better.
Oh, thank you. Okay. Well, in case anybody's wondering, we have a participant right back here. This is my cat, Mac. He's like, what? What'd I do? So I just wanted to introduce, in case anybody was staring at the cat instead of listening to us. Been known to happen. So what is involved? Well, wait a second. Before we get into that. So what I'm hearing is there's a mobility is probably the best thing, but are there other, can I just ask, are there other systemic kinds of problems that it could help with? And I was listening closely, but I just wanted to make sure that I heard everything that acupuncture could do well for.
Yeah. So the main thing is mobility. Number one, that's what people come in for, but that's not all it's good for. Interestingly, when we treat animals for mobility problems, there are other, we'll call it side effects or really effects, and that is people often notice that the dog or the cat's immune system is better. Maybe their allergies aren't so bad. Maybe the digestive system is better, even if we're not doing points to fix that, because it's all connected in there. So the focus, even on mobility situations, is on mobility, but other things improve too, because many points that are used to stimulate and support mobility are good for liver, are good for kidney, are good for other organs. In regard to metabolic disease, and seeing a cat there in the background, acupuncture is really helpful with kidney disease that we so often see with cats as they age. And it's been, now, as I've done it more and more, I think it's possible that if, for example, there's back tension, it pulls the vertebrae closer together, pinches the nerves, not just to the muscles, but maybe to the organs. So maybe some of the kidney disease we see in cats is because the nerve flow to their kidneys is diminished with age, and that then adjusts the organ's function and its ability to send messages back. So if we think of nerve flow like water in a hose, when you pinch the hose, you get decreased flow. So by doing kidney points, we relax the back muscles. That allows better communication with the kidney to the central nervous system and vice versa. And that helps stimulate what kidney tissue is there to work better. Certainly with age and time, we all lose some tissue, but fortunately, we're all born with more than we need. And often the disease is not a matter of quantity, but quality. It's like you have the function, but the disease is your body's not turning it on. And acupuncture and other therapies help to stimulate your internal processes to just work better.
That makes sense. Thank you. So tell me, what's involved in acupuncture treatment? How often? I mean, you talked a little bit about it, but what do you usually recommend people be ready to invest their time in? Just make sure that I'm clear on that.
Yeah, that's a great question. Our experience has been, again, most of what we see is not emergency medicine. People, the dog or the cat's getting older. They've tried other things. Maybe it's worked, maybe it hasn't worked. Maybe it's worked for a while and it stopped working. Maybe they just heard about acupuncture. So a lot of these are not acute disease, but chronic disease. And as I said, it's going to take a few treatments to see some improvements. So with that, my experience has been usually once a week to every 10 days for the first few visits. And then when we see improvements, if we were, say, weekly, and at number 3, you said, I think he's a little better. At the 4th visit, you're like, he's definitely better. And we see them getting up and down better, they're moving around more. Then maybe we go to every other week for 1 or 2 visits. If they're continuing to improve, you go to every 3 weeks, then every 4 weeks, every 6 weeks, every 8 weeks, trying to find the furthest interval that maintains and sustains them at that better level of function, mobility in particular. And they will drop off because unfortunately, most of what we're treating is not curable. It's treatable, but it's not curable, because if they have arthritis, they have arthritis. If they've lost nerve function, it's not coming back, but we can still get what's there to work better and slow the decline, which is age related. So that's why it seems there is some treatment interval. Again, the older or the more chronic the pathology, the more extensive, shortens the interval. So I have some dogs do best at every 3 weeks, but they're maybe 15 years old. But if they're 12 years old, they could go 8 weeks, 6 weeks. But their system lets us know when they need to come in. And I let the clients determine that. And what we look for is to come in just when it's starting to wear off, just when the last treatment seems to be wearing off, which again would imply that we have improved function, because if it's just stimulating the nerves or blocking pain, as some people think acupuncture does, those chemicals aren't in your system for that long, weeks after an acupuncture treatment. That's an initial effect, but we're actually helping the system do better, and therefore they're coasting along at a better level of mobility. And when they dip, they don't even dip as much for quite a while. So we changed the whole curve of quality of life. Is now it's not just quantity, it's quality and quantity, often for quite a while.
That's nice. That's what we're all looking for. We know they're not going to be with us forever, but if we get more time with them, and while they're with us, they're happier, they're doing the stuff they love, that's a great goal. That's a great outcome. But how do they react? I mean, you stick a needle, and I've had it done, and I've watched my one little cat do it, and for me, it wasn't terrible. It wasn't as bad as getting a vaccine, even close to that. But how about dogs and cats in general? How do they react to it?
So that's, again, great question. And one of the biggest things that keeps people away from bringing their pets, because their experience of their pet and a needle is going in for vaccinations or a blood draw, where often a little more restraint might be necessary.
Yeah.
Also, maybe the whole environment that they're working in is a little more anxiety provoking for their pets. Unfortunately, typical office visits are rather short. If you go to your veterinarian, you go in, they, pull the cat out of the carrier, put him up on the table, shove a thermometer up his butt,
Literally, right?
Hi, how are you? I wouldn't appreciate that either. It's important information, but still, there are ways of going a little bit slower. So here, since we don't do that.
I got to jump in. Just my analogy of that, I think, is they feel like they've been abducted by aliens sometimes in white coats, right? It's like, right. Oh my word. Okay, so yeah, that is, I think that's how they feel about regular vet visits.
Right. And many veterinarians are improving that, in that
I know.
They are moving a little slower, making the pets more comfortable. So acupuncture points are located all over the body, along the back, along the limbs, on the inside and the outside of the limbs, along the belly, along the face, just like with people. Fortunately, many points have overlapping function. Much of what we're working with is mobility. We want to loosen up the spine. We want to release that tension, stimulate communication with the central nervous system, the spine, with the extremities. Well, those nerves originate along the spinal cord. So with that, we use predominantly points along the back. So with that, and I've had acupuncture too, my experience is as you get closer to the fingers and toes, you notice those needles more with the initial placement. Even with those, once they're in place, you don't notice them. But still, as a people, we can rationalize it a little bit better. Pets tend not to. So mainly using points along the back, these little thin needles, and again, technique plays a role here too. I find if we can just slide them in kind of quickly and then leave them alone, they barely notice that they're there. We also tend to use very short needles. With a human, you can use a longer needle. It doesn't go in any further, but you can understand if you feel the little wobble of the needle handle, for example. Whereas with a pet, they know there's something on their back maybe. But if I use a very short, like with a Labrador, a 1/2-inch needle, which has maybe a 1/2-inch handle, even with the needle in place, they barely notice it's there. With a cat, I'll use a 1/4-inch needle. So again, or a small dog, they barely notice that they're in place. There's a little twitch, but often a little distraction. You rub their ears. I often will kind of stroke down along the back and then put the needle in, and then stroke down the back and put the next needle in. So they feel the stroking rather than the needle itself going in, because it's just so tiny. It's not painful.
No.
And so most of them do very well with it. Most clients are quite shocked with how well they do. And even with some extremity points, say by the ankles, there's a great point by the outside of the ankle that's good for mobility. There's a wonderful point down by the wrist that's good for neck pain. Some of the points on the inside of the limbs are hard to get to with animals because physically they can't rotate their leg out like a person could, or rotate their arm. If you watch them, they just can't rotate that easily from the shoulder. They're just made differently. So some points are less accessible and some are more accessible. But the ones that are accessible with the right needle size and the right needle technique, they're fine. And with each subsequent visit, they're calmer and calmer when they realize this is all there is to it. No one takes them to a treatment room. They look at you sometimes like, why are we here? We can sit at home and do nothing for 15 minutes. Why did I have to come all the way in? And the dogs are happy because they get a dog treat, and the cats get some attention and petting. And even the ones that don't like a lot of attention, we could put the needles in place, let them go back in the carrier with the door closed, 15 minutes, slide them out or pour them out, take the needles out, they go back in the carrier. Or some of them, we disassemble the carrier and then just set the top on so they think they're in there and no one's doing anything to them. And again, with each subsequent visit, they get more and more relaxed. And that's been the typical way things are proceeding.
I saw that with Bunny. She a number of years ago when she didn't love it. Once they were in, she's like, all right, nobody's doing anything to me. I think I'm going to explore. And she just walked around and checked stuff out and then just settled down. Like, and it did feel like she was settling because she was comfortable.
I think two things are going on there. One is physically, when you put a needle in, immediately things are going to happen. It's not always a big effect, but immediately you've got those nerve impulses going, shooting messages back to those tight muscles to start to relax so that they start to feel better. If they were a little achy or a little tight, it will relax. We also know, and studies show, that mammals have endorphins, which are pain-relieving compounds that the brain secretes. So acupuncture stimulates the release of endorphins. It also stimulates the release of your body's own cortisol, which is an anti-inflammatory. So you'll get that transient or temporary effect from an initial acupuncture. And again, those effects drop off, but the subsequent effects continue to build as they go forward. So I think we have some that almost fall asleep and some that do fall asleep. I've also found that giving them the freedom to move about a bit is very helpful. When I go for acupuncture, I have to lay on the table. I'm not allowed to walk around the room, but I usually take a nap, so that's okay. But the pets, if they want to move about a bit, I find it's better to let them move around. If a needle comes out, we can put another needle in place. It's just not a problem. I didn't mention, but we do use disposable needles. So each time we have new needles, we're not worried about any contamination or any problems in that regard. And indeed, the ones we use are the same that are used for people, and they just have a variety of sizes. Maybe for large animals, they need to use slightly thicker ones to get through the skin of a cow or a horse or other animals, but it's useful in those animals as well.
Okay, that's really helpful. Thank you. What about a lot of, I imagine since it's a chronic condition that a lot of the animals that you see or people thinking about this, about I'm on medication, or how's it going to affect, how's acupuncture going to affect it? Because you always hear the warning things on any medication you get. If you're taking so-and-so, don't take this medication. Or so, what's the effect of both of these treatments?
So
both the prescription and the acupuncture.
Usually there is no negative interaction between current medications or supplements and acupuncture. And it's mainly because they're working through different methods of action.
Okay.
So if two things are trying to do the same thing, they could double up or possibly counter each other, if you think of it that way. This is why you have to be a little careful with herbal medicines and drugs, because if you're taking a medication, say, that lowers your blood pressure, and then you take an herbal supplement that has components that lowers your blood pressure, you're going to have an additive effect. But But if you take herbs that don't do that, obviously they could be taken at the same time. Since acupuncture is working predominantly through the nervous system, and with that, you can only stimulate the body to do what it can do. You can't make it do what it can't do. So the side effects, the negative impacts are so low for that reason. It's almost like they either get better or they don't, but typically they usually do. So usually we see many patients who come to us that initially are on pain medications, anti-inflammatories, combinations of all the above, and some glucosamines and other supplements. And I'll usually tell people, keep everything the same. because they're here because they're obviously not perfect. Otherwise, they wouldn't have come in. They still have mobility problems. So if we introduce acupuncture and everything else stays the same, then any improvements can be attributed to the acupuncture. And then we can review the medications and say which of these is posing the potential or is posing a problem. Digestive upsets, potential liver problems, whatever, then those are the ones we wean out first. You don't have to stop them cold turkey. If you're on a pain med and the dog doesn't seem painful, cut the dose in half. A few days later, cut the dose in half. A few days later, cut the dose in half. Then wean off the next medicine. And if they need it, you'll reach a point where they need some, but they don't need the full dose. So we, for example, may have an 80-pound dog that's on a 20-pound dog dose. They can't get off, but they need a little bit because, again, they just don't have the ability, even with acupuncture stimulation, to treat or address all their symptoms. So, okay, medications are helpful, but that lower dose is much less likely to cause metabolic problems and cause side effects, if you will, down the road. And that is also a common thing where we've been able to get off many, if not all the medicines, or put them on the shelf and use it as a spot treatment. They overdid it, so that night you give them a single dose and they're better by the next day. It shouldn't work. With other dogs not getting acupuncture, a single dose once in a while just doesn't work. You need to maintain a blood level and all of this for the full physiologic effects. But in these patients, they've got most of it. They just need a little helping hand once in a while, and that's why that approach can work. With age and time, as things do deteriorate, you're shortening up your acupuncture interval again. Maybe you got them out to every 8 weeks or 10 weeks. And then a year later or whatever, if a year and a half later, maybe you got to go to once a month. At the same time, you may need to increase your drug doses, but you've been able to put that off for many months, if not a year or two, which is just better for them physiologically over the long term.
Wow, that's really good news, though, about the medication. I mean, I don't know about you, but I'm always in favor of less medication for our bodies and letting them figure out how to get back to some good functioning without it. Thank you. And I hope you've got a few in the back of your mind, but I always like to hear real success stories. I know you probably can't tell the real names or anything like that, but can you give us a couple examples of animals who really it really made a big difference where they were when they started and where they are now and how it helped them?
I think that, in a way, the problem is there's so many. I expect them all to get better because so many do that I'm not shocked anymore when we see improvements. The clients are all like, it's amazing, it's fantastic. And to me, I'm like, yeah, they all get better. But some have been dramatic, and one would be a dachshund belonging to one of my own receptionists years ago before she was my receptionist, but she worked at Southpaws where I was. Dachshunds are her dog, that's her breed. A client came in with a dog that had a slip disc, as we would say in common terminology, swollen disc. They could not afford the surgery, so she adopted the dog and had the surgery done, but even post-operatively, the dog still couldn't walk. So we started acupuncture immediately, and within a few treatments, the function came back. Now, this is a dog who maybe the function would have come back, but it could have been weeks, it could have been months. Many indeed will, even without surgery. If you are patient enough, often the body can do some repair. The acupuncture in this case was amazing how quickly he came back. I'm just thinking of another smaller dog, a terrier with severe neck pain, because they have some neck problems and neck disc problems. Again, with medications better, but was still yelping every time he tried to move, because either it did pinch or he was afraid it was going to pinch. I think 2 treatments, and they were just like, it's amazing. They stopped the medications, and he's like walking around, shaking his head. It's just unbelievable. And again, how many older, say labs, golden retrievers, German shepherds, those larger dogs, even giant breed, but the larger dogs, they're just slower, they're stiffer, the back end is sinking, they have trouble getting up, they certainly can't do the stairs. And again, often within just a few treatments, they're not 2-year-old puppies running around, but they are back engaged with the family, they're getting involved in what's going on. And there are limitations on how much better they'll get. And what people are looking for. One case that sticks out was a client with a white German Shepherd, and I remember she came in without the dog first. She said, I want to talk to you first. And I said, fine. So we did basically what we're doing. I explained how it works, what we could expect, no guarantees. And she said, okay, hold on a minute. She went out, brought the dog, and came in. I felt by the second treatment, the dog was showing improvements in the exam room, in that getting up and down smoother and moving better. And she said, oh, he's no better. And each time she kept saying, no, he's no better. And he was definitely better. So at number 6, as I said, 6 is my cutoff. So at number 6, I said, okay, this is it. What do you think? And she said, I was going to say he's no better, but then I was also going to complain that he's always underfoot. She said, and then I realized, wait a minute, he's always underfoot. He's not sitting over in the corner all the time. So what you're looking for can limit what things improve and how they improve. With time, I think he got even better. But again, starting off, they're not going to be running up and down the stairs, but they hopefully will show some improvements.
Hi, we're recording again, and I just lost power as you talked the great. You were going for a great story with the white shepherd. So let's keep going, and then I'll see if I can fix this.
Okay.
There's so many good information here. I don't want to just give it up. So first she came in, here's what I heard. So first she came in to check you out, and then she decided to bring her dog in. And that's where that's where the power went.
Okay. Got it. Okay. So again, like many people, she was skeptical, put it that way. But after speaking with me, I was able to give her reasonable assurance that it could do some good. So she wanted to try. Again, she came in weekly for the first few times. By the third treatment, I thought the dog was doing better, walking around the room, getting up and down a little easier, but she insisted the dog was no better each time. So we got to number 6 finally. And as I said, I used 6 as my cutoff. And I said, okay, this is number 6. What do you think? And she says, well, I was going to say the dog is still no better, but I was also going to complain that the dog is always underfoot. Then I realized, wait a minute, the dog is always underfoot, which means she's not over in the corner all the time. So this taught me to have clients not have unreasonable expectations, but don't lower your standards, just broaden your standards of what you will see. And people often notice, even after the first visit, maybe the second, they'll say, this may sound funny, but she seems happier. And how do you quantify that? You can't. It's something about their body language. It's about the way they interact. They'll say there's a little more sparkle in their eyes. And to me, that's them saying they feel better. The physical improvements haven't come along. The physical improvements haven't come yet, but they hopefully are coming soon. And often by the next visit or the one after, that's when people see getting up and down easier, now wanting to go for walks, able to go for walks. So many people have said they're back, the dog is back picking up their toys again. Again, a 12-year-old's not going to be a 2-year-old, but a 12-year-old could be a 10-year-old, or a 14-year-old could be a 12-year-old. And those are the kinds of changes that we see. And I'll tell folks, I can't guarantee how it's going to manifest when you start, or again, how much better they're going to be, but you have to keep watching, and we see. And if at any point it's not giving the results you're looking for, you can always stop. You can stop and restart. I have had people not sure if it's working. So I said, fine, stop, call us if we can help you. And a few weeks later, they call back and say, it was working. I want to restart. So the first thing they noticed was the dog was on a downhill slide. And then the treatment stopped the decline. So they maybe were only at a plateau at first, but then they saw a bit of a lift, mild, so they didn't see it until we stopped the treatment. Then they started to decline again.
Yeah.
So then by restarting, again, many of those guys pick up. But if we can simply have a dog that's on the downhill plateau, that's a plus right there, and hopefully a bit of a lift. And then, hanging out at that plateau, we all have good and bad days, but hopefully the good days are better. The bad days are not as much or as often. And when people start to look at it that way, then they can visualize those changes. We all have busy lives. So subtle changes, just like the decline was subtle, the improvement can be subtle, but it's real. And if it's not real, then you don't continue. I have one client, I still remember it's not working. But she said, but my neighbor said he sees the difference. So, it's obviously the dog is better, but maybe the dog's walking behind her so she can't see it. I don't know. But consistently, we see those kinds of improvements for quite a long time, which is still gratifying, still amazing that we can just put these needles in and have this work, but would also explain why we're seeing a growth in acupuncture use in animals throughout the country. When I did the acupuncture training in 1990, there was only one organization teaching veterinarians. They could only get enough interest to have the class every other year. That's how few veterinarians were interested. Now there are 2 places teaching. They have courses every year. One of them has modified part of it to an online, so they don't have to go to the facility each time, which increases the ability of even more veterinarians to get the training. And even in our area, more and more veterinarians are doing as I did, where they're introducing acupuncture into a general practice. And again, what I'm doing doesn't have to be a separate specialty. I just got so busy doing it that I figured I could do this alone, and indeed it worked out. And now with more experience, I'd hope if general practitioners that are using acupuncture see a patient, try some acupuncture, they don't get better, but he should have, that they would maybe refer to one of our doctors, because we've all practiced for a good number of years, just like you would refer to a surgeon or another specialist or an internist. Right. Yeah, you're trained in those things, but some of them maybe are out of your experience. Or we could get a case started, and once they're in, especially if someone's coming from a distance, we could do the first few treatments, and if the animal gets better, we're happy to share that information with the general practitioner who does acupuncture and just say, well, these are the points we used, and then maybe they can pick up the case. Then the pet still does better, longer, and the people don't have to stop because of the distance or the travel or something like that.
Right. That's great. That is fantastic. This is very heartening, I think, because I think all of us, when we watch our animals, particularly animals decline or watch the mobility go away, and it's heartbreaking. It's really heartbreaking because we know how important that is to most of our animals. The walk, the running, the play it's part of the joy of their life. And so, and kidney issues and digestive issues and allergies, oh my golly, that also, drives them and us nuts. So I hope that everybody starts thinking about acupuncture as something that pops up in their head when there are issues and maybe it's just not working as well as you'd hoped. Doing the regular stuff, if that's the regular veterinary treatments, take a look at acupuncture. So thank you so much for taking the time to do this with me, Dr. Kocen. This is really fascinating and such good news for everybody who has a pet. Is there anything else that I didn't ask that I should have?
Well, I would like to say that because I've been doing it for a while and other veterinarians in the area are doing it for a while, many practitioners and veterinarians who don't do acupuncture have seen the benefit because these pets come back to their practice. And so we are seeing a larger amount of primary care veterinarians that are either recommending acupuncture at the outset, or they've tried medications, it doesn't work. They'll say to the clients, hey, what about acupuncture? Or if the client comes in, because they trust their vet and their vet's opinion, and they'll say, what do you think about us looking for somebody doing acupuncture or other holistic therapies? And I would say the vast majority of veterinarians, certainly in our area, are all for it. They maybe didn't think about it because it's not on their radar, because they don't do that. And the client's coming to them, they think you're coming for their care, and you are. But at some point, if it doesn't work, then either they'll make a direct referral or recommendation to us or somebody else, or to support the client's decision to come. And then we're in touch with the regular veterinarian to let them know we've started. They can check in with the client. They can check in with us. And lastly, I guess, if a client has a pet with a condition that they don't know if acupuncture or other alternative therapies can help, they can always call our office, or I think any practitioner with holistic therapies, and say, do you think you can help? And again, there are some things which don't respond so well, and we'll be pretty forthright. Either those do great with acupuncture, or some of those have gotten better, or we'll say, say with acupuncture, I don't think acupuncture will help. Maybe you need to get massage or rehab, or no, continue with the medications. That's the best way to treat that. All the therapies are good. It's having the understanding and appreciation of what will work well in which case, which ones do play well together, which ones could have a negative impact, which is rare. That's holistic medicine, is drawing on all of these therapies, or maybe better to call it integrative therapy, because you're integrating different medicines at different percentages over time. And again, you start off with more drugs, less acupuncture, and as they respond to the acupuncture, you use less drugs. It's a continuum. And in the end, overall, more and more animals are healthier and longer.
I love that. Thank
you.
you. Thank you so much.
Good. Thanks for doing this. I appreciate talking to you.
All righty. And I'll put the information about the Veterinary Holistic Center for all of my folks who are in the local Northern Virginia, Metro DC area down there, so that if you have questions, you can call Veterinary Holistic Center, Dr. Kocen. All right. Thanks. We'll talk again. All right.
Bye. Bye.